Good evening. My name is Faheem Tadros. I am a consultant otorhinolaryngologist and facial aesthetic surgery. And I'm going to discuss with you today a subject that is very dear to my heart, which is rhinoplasty. Rhinoplasty is a procedure by which we improve the shape and the function of the nose to patients. Earlier in the 18th century, medicine was all about saving lives. But by the 19th, 20th century and the present century, our interest and our vocation in medicine extended to include improving the quality of life and having the patients feel as a whole, body and soul and psyche, better about himself and about his body. By the beginning of 20th century, people invented all sorts of contraptions to improve the nose and the shape of the nose. And in some of museums, you will find some weird and wonderful instruments planned to fit on the patient's nose, and they thought that by just twisting it a bit to the right and twisting it a bit to the left, they can improve on the shape of the nose. But unfortunately, that proved to be unsatisfactory. Now, rhinoplasty is interesting as a procedure because there aren't two noses that are exactly the same. Not only that, but there are no two faces that are exactly the same, with few exceptions, the exception being in the identical twins. When we are discussing a nose to fit the face, we are discussing different kinds of issues. A, the shape of the face. B, the ethnicity of the patient, which ethnic group does he belong to, and C, you want the nose not only to fit the face, but the different parts of the nose to fit each other. So you want a tip that is in sync with the dorsum, and a width that is in sync with the height and the depth. So there is a little bit of artistry as well as medicine in this rhinoplasty procedure. What's so exciting about rhinoplasty in the Middle East is that we are really a melting ground for many genetic and ethnic backgrounds. There are different categories, different kinds of noses. There is the Semitic nose, in which there is an arched nose. The arch is predominantly bony, and it is a really high arched dorsum with a low tip. And in this kind of nose is quite prevalent in the Eastern Mediterranean. When we come nearer to Asia and India and the Indus Valley, we have a different kind of an arched nose, which is the arch is predominantly cartilaginous, not a bony one. And again, that requires different techniques and different assessment. Add to this the African nose with its wide eye and its low height, and you get a concoction of varieties of noses that can be sort of challenging to the surgeon and can be sort of challenging to the patient as well. There are some who come and want a different ethnic kind of nose. I generally discourage them. I like to have a patient to have a natural look. I want an Indian to look an Indian, a Middle Eastern to look a Middle Eastern with a fine nose. However, the patient's wish is certainly something that I take very highly into consideration, but I do advise that a natural look is much more acceptable than an exaggerated synthetic look. As you can see, and I'm sure many of you have seen patients and celebrities with noses that look totally out of face and totally out of ethnic background. Now, to my way of thinking, a successful nose is a nose that fits the face and fits the persona and the character and the ethnicity of the patient. I tell my patients the nose is like a background music in a film. It should not overshadow the hero and the heroine. It should be accentuating them. In the face, the hero and the heroines are the eyes, and the nose should not distract from the eye. And a beautiful nose is a nose that leads gently to accentuate the beauty and the eye of the patient. I think I have been working in the area of rhinoplastic surgery since the early 1980s. My happiness is a smile on my patient's face and a satisfaction that he has a natural, beautiful looking nose that is functional. There's no point in giving a patient a nose that looks pretty but is good for nothing but have a pair of spectacles sat on it. You have to have the functionality as well as the aesthetics involved in it. Failing either one of those is not a success. Giving a synthetic nose is not a success. Natural beauty is to have a naturally looking rhinoplasty, which is the essence of a successful one in my book.